would have liked to have attended and joined us, but could not because of other commitments. So they've asked for it to be recorded. I am Dr. Amanda Brooks. I'm the Vice Provost for Research and Scholarly Activity here at Rocky Vista University. And it is my absolute pleasure today to introduce our speakers and to monitor this session and moderate it. So Ms. Tilly Lawrence is a scientist, nurse, and program manager with Leidos. She's leading research programs that will hopefully and rapidly find solutions to help us with long COVID. As a first-generation American and a classically trained dancer, she merges her life experience and wisdom with science and technology to redefine wellness, resilience, and human potential. She hopes to revolutionize how we measure, understand, and optimize the nervous system, bridging science, AI, and real-world data collection. She's passionate about holistic, accessible health solutions, and Tilly's work is not only transforming the future of medicine, education, and human flourishing, but her work is also dedicated to her own personal growth and that of her family and those around her and in her direct community. She lives in Maryland with her husband and 2 teenage daughters and 2 doodle puppies who hopefully are going to sleep through this. She also is, she says, an average citizen scientist trying to connect all the dots and live a joyful, purposeful life. And I think that that describes a lot of our audience today is we are citizen scientists trying the best we can. So then we are also joined by student Dr. Mateus Cruz, who is a 3rd-year medical student. And he is one of our distinguished OPP fellows, or Osteopathic Principles and Practices fellows. He's actually over in the clinic part of the time, seeing patients and really helping to teach and learn the art of medicine. He is on our Utah campus as well, I should say that. And he's currently working on conducting a study on post-COVID-19 syndrome, investigating cognitive and physical function changes with a low-dose nicotine patch intervention based on a nicotine hypothesis that he'll talk a little bit more about. He also has clinical experience managing patients with post-viral syndromes in that osteopathic setting over in the Rocky Vista Health Center. He's a former EMT supervisor, and he's worked as a medical assistant in both pain and spine clinics, treating patients with chronic pain syndromes, which share a lot of similarities with long COVID. So you will understand very shortly when he starts talking why we have chosen him to be our representative student doctor on this. He also has clinical experience as a scribe in oncology and hematology clinic, providing exposure to a lot of chronic disease management. And he's just all around a nice guy who's got a lot to tell us. So without further ado, I am going to turn it over to Tilly to kick us off. Take it away.
Thank you, Amanda. Hi, everyone. I'm really excited to be here today to talk to you about long COVID. You might already know much about what I'm about to tell you, or this information could be eye-opening because it might connect a dot or two in your own personal health and wellness journey. In either case, we're still researching and we're still wayfinding. So don't hesitate to reach out if you have any questions, and also talk to your personal healthcare team. Ask them your questions, share what you might have learned today with them, because if there's one thing we did learn from the COVID-19 pandemic is that we're better together, connected. So next slide, please. The greatest teacher failure is. That was by Yoda. I'm going to make an assumption that most of us are familiar with the Star Wars saga. Just in case you're not, the first Star Wars movie was released in 1977, and I saw it with my dad, and I was Princess Leia for Halloween for the next 5 years. It's a huge franchise today, but at the heart of the story of Star Wars, and likely why it's still relevant today, is something called the Force, an all-pervasive essence that holds in balance the forces of good and evil. Well, what in the world does that have to do with long COVID? Next slide. Let's revisit the SARS-CoV pandemic really quick. This data was pulled from our last president's pandemic preparedness plan, which was published in 2022. The COVID-19 pandemic gave us the worst economic crisis since the Great Depression. There were supply chain disruptions to our greatest needs and resources like food and medical equipment. Small businesses struggled and closed doors. 20 million Americans lost their jobs, and it cost the government an estimated $16 trillion. And we were worried and scared and isolated from our communities and tribes. And now that it's over, we've been introduced to something called long COVID. Before we get into what it is, let's talk about who it's affecting. Next slide. This data was pulled from the Health and Human Services Strategic Plan for Long COVID, published in October 2022. 11% of adults in the US are experiencing long COVID. 25% of adults with long COVID experience significant activity limitations. And it mostly affects people ages 45 to 65, and mostly women, and mostly those of ethnic minority groups, and mostly those people with pre-existing conditions. And it could cost the government upwards of $3.7 trillion in healthcare costs, lost wages, and reduced community resources. Updates for these numbers here in March of last year, that 11% of adults in the US dropped to 7% of all adults experiencing long COVID, but that's still roughly about 17 million people reporting symptoms, where it states that 25% still report that long COVID limits their activities significantly. So that number, 25% of adults with long COVID with significant activity limitations, has remained the same. Next slide. So what is long COVID exactly? It's broadly defined as signs, symptoms, and conditions that continue or develop after initial SARS-CoV-2 infection or reinfection. It's a mishmash. It's a collection of symptoms that could last 3 months or longer after your first COVID symptoms appear. It can steal your energy, your ability to think clearly, and your sense of smell and taste even. You might feel anxious or depressed, get frequent headaches, be short of breath, have heart palpitations. There are approximately 200 different symptoms identified. Next slide. Here are some of the most common symptoms: GI complications, brain fog, dizziness, fatigue, anxiety and depression, sleep disturbances, heart palpitations, and a cluster that are indicative of neurological dysfunction, cognitive dysfunction, and immune dysregulation. Our job has been to disassociate and disentangle all of these conditions, and it's been a rough go. The direct causes of long COVID, to be able to narrow down for potential treatment options, have eluded us, but we do have a couple of hypotheses. Next slide. One hypothesis is that the COVID-19 virus stays quietly in our tissues and cells, triggering chronic inflammation or autoimmunity, where your body attacks its own healthy organs. So things like dysautonomia, fibromyalgia, chronic fatigue syndrome, Lyme disease, and lupus. We'll just take dysautonomia as an example. Dysautonomia means there's a problem with your body's nervous system that controls things that you don't consciously think about, like blinking or your heartbeat. You don't think to tell your heart to beat or how much your blood pressure changes. You might have heard something called POTS, which is a type of dysautonomia where your heart beats really fast when you stand up, all by itself. Lyme disease is bacterial in nature and can be dormant after infection, but if triggered, an inflammatory response occurs in your body, leading to joint pain, nerve pain, heart inflammation, fatigue, and memory loss. Lupus is autoimmune in nature. What are its triggers? Viral infections, sunlight exposure, hormonal changes, stress, anxiety, and it's different for everyone who has lupus. So many. We've really only touched the surface of these symptoms, but let's take a look at some of the ones that are really common across all age groups. Next slide, please. So in school-aged children and teens, even during the pandemic, sleep disturbances, loss of confidence, social insecurity, stomach aches, headaches. In adults, we're looking at depression, anxiety, drug and alcohol abuse, risk of heart disease, suicidal tendencies, and obesity. And in our aging, high blood pressure, high cholesterol, cognitive decline, neurologic decline, and loneliness. Many of these symptoms like overlap between all of these age groups, and the entire course of the pandemic, from when it officially became a public health crisis in January 2020 to its end in May in 2023, really left Americans in a generalized state of unwellness. And this generalized state of unwellness, I think, could be the new public health threat of the ages. What I think is important to call out here is loneliness, and it's not reserved for the aging. It's everywhere. It's pervasive. It's becoming very pervasive. According to a January 2024 poll by the American Psychiatric Association, 30% of US adults experience loneliness weekly. 10% of adults report feeling lonely every day. So why should we worry about loneliness? And we should, but how can we help that? Next slide. There's something to being connected to others. A study done in June 2022 looked at the effects of loneliness on fear, or how COVID-19 caused anxiety simply by disconnecting each other through social isolation. What they found was that pandemic-related feelings of social disconnection might lead to disordered fear. In other words, irrational fear, kind of like fear of missing out or FOMO. That's a thing these days. I would say that would be an irrational fear. Being socially disconnected during times of threat could lead to being fearful most of the time. And the third finding was feelings of connectedness may reduce fear and trauma. So that's the good news finding that came out of this paper, that feelings of connectedness may reduce fear and trauma. Makes complete sense. So let's explore the why and the how feelings of connectedness could reduce fear and trauma. What happens when our natural and normal communication pathways are disrupted? Next slide. So what tools do we have in our human body that assist us in communicating with our environment and with each other? Our bodies are equipped with many tools to help us communicate, but I'm going to highlight 6 of them. The first 5 are our senses of hearing, seeing, smelling, touching, and tasting. So there's 5. And the 6th tool is our vagus nerve. Next slide. The vagus nerve is the 10th of 12 pairs of cranial nerves that originate in the brain, and it's the longest, connecting the brain, heart, lungs, digestive system, and immune system. And it's the only nerve of 12 that does that. It transmits information to and from the brain to tissues and organs elsewhere in the body. To and from. So it's bidirectional, meaning it both sends and receives signals, making it the primary communication highway between the body and the brain. Incredibly, it's the only nerve of 12 that does that. Vagus comes from the Latin term that means wandering. It's everywhere, wandering around our organs, tissue, viscera, and muscle. That viscera is that white, thin saran wrap like film that you might find sometimes when you peel it off of a chicken breast before you cook it. That's what the viscera is like in the human body, and it wraps around our intestines too. The vagus nerve is there. In fact, the vagus nerve is responsible for the gut-brain connection, sending 80 to 90% of its signals from the gut to the brain. That means it potentially could regulate digestion, mood, immune response, and inflammation. No other nerve has this level of whole body influence. And it's the only hackable nerve. What do I mean by hackable? More research is showing that the vagus nerve can be activated voluntarily, and it seemingly controls the switch inside you between stress and relaxation states. This means that accessing your vagus nerve might influence mood, digestion, and maybe even give you more cognitive clarity. To understand the vagus nerve a little bit more, I'd like to talk to you about the polyvagal theory of safety and connectedness. Next slide. So this theory, polyvagal theory of safety and connectedness, was developed by Dr. Stephen Porges in 1994. It explains how the vagus nerve regulates a part of our nervous system that influences our body to feel safe, connect with others, and respond to stress. The theory introduced the concept of 3 nervous system states: social engagement, fight or flight, and shutdown, and how they shape our emotions, behavior, and resilience. So in the social engagement phase, you are likely saying to yourself, I am one with the force, and the force is with me. Your body is at homeostasis. You're at a flow state. You have positive energy, and you likely can say, I can, to most of the things that happen around you. All of your circuits are running smoothly. You have logical thoughts. Your heart is beating nice and steadily, and your blood pressure is great. You are at rest and digest, and your body is healing. The next stage is fight or flight. I think a lot of us are familiar with this stage. It's go time here. Do or do not, there is no try. Your body's resources are being funneled to all of your major organs to sustain an action of fighting or fleeing. You likely have nervous energy. There may not be logical thought because we're mostly reactive here, and your thoughts are somewhere settled around the I'm scared and unsure, but I gotta make this happen. It's go time. And that last phase or shutdown is where we really don't want to be. This is where Darth Vader called it the end. I'm not your failure, Obi-Wan. You didn't kill Anakin Skywalker. I did. This is where you have body and mind dissociation, freeze, shutdown, isolation. There is no hope that can be pulled from your depths. You have negative energy and you're numb. You're neither here nor there. And this really isn't a good place to be. This is shut down. Your body is done. Next slide. So what? This is all interesting, but there are two more important points about Dr. Porges' theory to be able to tie this all together. And these points relate to co-regulation and neuroception. Co-regulation is the mutual, unconditional acceptance of yourself and your decisions and of those in your tribe. And we naturally and unconsciously emit signals to each other without saying a word. We emit our signals to each other and our environment. And our environment picks up on those signals and also reacts. And then there's neuroception. Our senses serve as the surveillance system to our environment. And humans were naturally built to sense. So now let's think about and circle back to long COVID. We're looking for treatments to help relieve some of the over 200 symptoms associated with it. And the vagus nerve has our attention. And if understood, accessing the vagus nerve could potentially be the fastest, most cost-effective, accessible, first-line method of supportive and personalized treatment. Because remember, that special nerve, the only one of 12 that is bidirectional, and it's the super highway of communication in our bodies, sending signals to and from the brain, sometimes with thought and sometimes without thought. I think the vagus nerve warrants a lot more research. Next slide. So these are the research questions that we've been asking ourselves. The first one being the most interesting in terms of, could long COVID be a physiologic traumatic stress response? Some other questions we're asking ourselves is, how important is the vagus nerve to our mental and physical health and wellness? How important is vagal tone to human resilience? How can we accurately measure vagal tone? What lessons did we learn from COVID or long COVID, and how can we apply them to preparedness for the next pandemic? And how much do our thoughts and mindset control our physical well-being? Do all humans have this force? Next slide, please. These are two studies done on vagus nerve stimulation. The first one was done in 2020 on the left, and that just shows us that the vagus nerve stimulation has been identified as a potential therapy for cardiovascular disorders such as cardiac arrest, heart attacks, and stroke. More research needs to be done here. The second one was done in May of just last year. And that study piqued our interest with its relationship to long COVID because it showed that transcutaneous nerve stimulation in a small study in women, very small, only 25 females, showed that it improved long COVID symptoms. So the results are really, really encouraging, but we still need to look at that closer. Only 25 females. What about the males? Can we explore biological markers that can inform personalized treatment options? So again, we're scratching the surface. So much more to learn. Next slide. So we don't know what the future will bring. Difficult to see, always in motion, the future is, but we're going to do our best to figure out a path forward to treat long COVID. Next slide. Long COVID is not one condition. It represents many potentially overlapping entities, likely with different biological causes, different sets of risk factors, and outcomes. So humans are so bio-individual, and if vagal nerve stimulation is a potential therapy for long COVID, we should absolutely try to figure out the how and the why and make it accessible and affordable quickly. I'd now like to introduce you to student Dr. Mateus Cruz, who will talk to you about the emerging treatments and other research.
Good afternoon, everyone, and thank you for being here. I'll be discussing what doctors are doing now to treat long COVID, but before so, Tilly, you did a phenomenal job of exploring what long COVID is and what we currently think causes it, and the ongoing research being done to help those affected. But before we dive into emerging treatments, I just wanted to review some of the stats that Tilly mentioned because long COVID is having a huge impact in our society today, even though we may not see it. Next slide. Currently, 14% of individuals who test positive for COVID-19 will experience long COVID symptoms. That's 1 in 7. Now, that may not seem like much, but like Tilly mentioned, in the US, approximately 7 to 11% of adults are living with it. Now, that's 18 to 28 million people, right? That's more than the population of Utah, Colorado, Idaho, and Arizona combined. And financially, right, the long COVID burden is estimated to be $3.7 trillion, right? And that stems from factors like frequent doctor's visits, diagnostic tests, treatment costs, right? And it's hard to work when you're suffering. And so as employment goes down, disability claims go up, right? And if we look more closely, more locally, next slide, in Utah, that's currently 1 in 12 adults. And in Colorado, that's 1 in 15 adults. And so next slide, as Tilly mentioned, there are over 200 reported symptoms of long COVID, with fatigue, brain fog, and respiratory issues being the most common. And you may feel like Han Solo here, just coming out of hibernation, right? He's so unwell, right? And sometimes it's easy for us who don't have this disease to see symptoms as words on a page, right? And we forget the real impact that they have on individual lives. And so to illustrate the impact, I want you to listen to a poem written by a long COVID patient as she describes her experience with brain fog, one of the most common symptoms. I want you to put yourself in her shoes and think about how you would feel if you had these symptoms. And some of you already have these symptoms. And so next slide, Dr. Brooks. This is her words. They call it brain fog, fatigue, long COVID. They name them themselves, brain fog. When all of the words I learned disappear, reappear, disappear again. I stare at words, images, no sound, no signified, just signifiers that float in midair. My brain tries to grasp them as I used to. It's angry now that I can't. It knows it's capable. I did it before. I sift through meanings. I'm more efficient than this. And deep down, I know I am. But there's a break that was hit, a smog that was released, clouding one's sharp connections, poisoning them, toxifying them, destroying them. Could you feel the frustration, the struggle that many individuals face? Like it's not just a list of syndromes, right? It's life altering. These are people who struggle to work now, to parent, to even have day-to-day social interactions. And so long COVID as well doesn't just affect those who are unhealthy, like Tilly mentioned, right? It's those who are young, adult, you don't have to be just elderly, right? It can happen to anyone. And so let's meet Una Cousins. Next slide, Dr. Brooks. So Una is a elite Irish rower, and I hope I'm not butchering her name right there. But she just achieved her dream of representing Great Britain in the 2020 Tokyo Olympics. And while training for it, she caught what seemed like a mild cold. Come to find out, it was COVID-19. And soon she developed severe long COVID symptoms. She went from training hours a day to struggling to get out of bed. And in 2024, so just last year, but 4 years after her mild cold, this is her experience. I still have symptoms every day that I'm managing. It's not something you can push through because you just make yourself more and more sick. I can't work full time. I can't do any exercise apart from maybe a gentle 15 minutes. Anything beyond that triggers symptoms. She then highlights the stigma surrounding chronic illnesses that seemingly have no cure, saying, with chronic illness, there's this idea that it only affects people who are lazy or who don't look after their health. But I train 25 hours a week. My whole world revolved around my body and my health. And that didn't stop me from being completely debilitated by long COVID. This is an illness that is demolishing people's lives. And then people are going to the doctor and being told that it's in their heads and the disease isn't real. So despite being in peak physical condition, right, an Olympic athlete, Una's body could not fight off the long-term effects of COVID-19, showing that anyone can be affected no matter how fit or disciplined you are. And so just to emphasize, like these symptoms are real and they are extremely debilitating, right? Next slide. So what are doctors doing to help people right now in clinics and hospitals? It's important to me to highlight, just as Tilly did, that as research continues, treatment protocols are evolving, right? Since there's no single cure, treatments currently focus on symptom management. The primary strategy today is treating symptoms separately to improve overall health. And there are additionally specialty clinics that are emerging and promising research is underway. We'll get more into that separately. Next slide. We're going to start out with symptom-specific management. That's just a big word of us targeting a specific symptom, right? And working through that. And so to explain this approach a little bit better, I want to use an analogy. And if you haven't guessed it already, it's another Star Wars analogy. So next slide, Dr. Brooks. So, all right, let's imagine that symptom-specific management is the Empire, led by Darth Vader, searching for the rebel base. They're conducting a galaxy-wide search. Right, they're visiting different outposts to gather clues, and each outpost provides a small fragment to the larger puzzle. Some lead to dead ends, and others bring them closer to the rebel base. So similarly, doctors treating long COVID act like the Empire searching for the root cause. And I'm sorry, Jedi fans, that's the best way I can put it. But each symptom is serving as an outpost, and they're offering clues that help us move closer to understanding and addressing the condition. So let's hop into our TIE fighters. And let's explore these outposts together. The three most common symptoms, right, are fatigue, brain fog, and difficulty breathing. So we're going to focus on those. Next slide, Dr. Brooks. Okay, let's start with fatigue. Now, originally, sometimes we think fatigue is just feeling tired, right? Or maybe I'm a little lazy today. But really, it's more of a deep, this like unrelenting exhaustion that does not improve with rest. And it makes even simple tasks overwhelming. So brushing your teeth, combing your hair, taking a shower, right? Those become unbearable to even think about, to even accomplish. And so what do we do in the clinic? Well, first, unfortunately, there's no biomarkers currently that we can use to test and confirm whether or not you have long COVID, right? But we rely on our clinical exam in doing so. And so for fatigue, that means that we're going to want to understand the severity of it and the pattern of it, right? Is it daily? Does it come and go? Is it worse in the morning or worse in the evening? And whether exertion or like exercise, we push ourselves, worsens it. And what's the treatment for this? So it's mostly going to be supportive. And that is, number one, are you getting enough adequate rest and a good sleep hygiene, right? Prior to having long COVID, your body might have been capable of compensating for poor sleep. But now with long COVID, it can no longer do so, right? So we're going to focus on one, do you have a consistent sleep schedule? And if you're changing that on the weekends, that also plays an effect, right? Are you sleeping for 7 to 9 hours? Are you avoiding screens 30 minutes to 60 minutes before bed? And are you stopping to eat 3 hours before bedtime, right? We want your body to be focused on restoring itself, not in digesting. And so the second aspect of fatigue is a gradual return to activity, right? We know exercise has so many benefits, but we don't want to overdo it. And so we're going to start with simple movements. Even while laying on your back, we can do snow angels, right? Or jumping jacks while laying on your back. We can do, if you're able to, we can do low movement exercises like yoga or high knees. Probably not in the gym, but at home on a YouTube channel, we can kind of modify that and do that. And then lastly, we're going to monitor for post-exertional malaise. And that's a really long word. Basically, it's saying after exercise, are you feeling extremely tired? And if you are so, or if the fatigue worsens the next day, then we're going to scale back that activity and we're going to start small. And so you can see how frustrating that could be, especially for someone like Una, right? Who's 25 hours a week, and now she can only do 15 minutes. Anything more than that will trigger symptoms. And so it's a very slow process, but we're working on getting you better every single day. Next slide. Hey, brain fog. What is it, right? It's this mental cloudiness. It's like the poem said, and it makes it hard to focus, recall information, or process our thoughts clearly. And it usually leads to depression, anxiety, and lack of sleep, which just further induces that fatigue, right? And so you come in the clinic, what are we going to do? Well, to evaluate, we can use cognitive assessment tools, which is just looking at brain function. We're going to test, how's your ability to recall memory, to word find, and to language process. And that kind of helps us establish a baseline that we can track improvement, or whether your symptoms are worsening, or whether new symptoms arise. So it's a really great tool to help us with that. And then how do we treat it? Well, we're going to go a step further now just with sleep hygiene. We're going to check for insomnia. Do you have difficulty falling asleep? Do you have difficulty staying asleep, right? Do you wake up multiple times at night and can't get back to sleep? We're going to look for sleep disorders like obstructive sleep apnea. Are you unconsciously stopping your breath while you're sleeping? That also causes an effect, right? Secondly, we are going to prescribe talk therapy, to help manage frustration and negative thoughts, to learn mindfulness techniques, and to help prioritize mental energy. And just a little caveat here, the top athletes in the world have coaches, right, to help reach their potential and improve their athletic abilities. So it's okay for us to talk with therapists to help improve our mental and emotional abilities. I feel like there's a stigma around that, but anything to help is the best course of action, right? And so I'll get off my soapbox there. And the last thing we can do is exercise again, right? When we exercise, we improve blood flow to our brain, and that delivers more oxygen to our brain, and it just takes away any of the inflammation or the nasty stuff, right? That's the in your body. Okay, next slide. Lastly, we have respiratory symptoms, so difficulty breathing. And that feels kind of like you can't get enough air in, right? And it could be associated with wheezing and coughing and chest pain. So to evaluate, we do a couple of different things. There's something called a 6-minute walk test. We just have you walk for 6 minutes, and we're evaluating how far you've walked, your heart rate throughout it, and what oxygen saturation you have, right? And this is another tool to establish that baseline. Secondly, we'll check for an X-ray. We'll see if there's any lasting inflammation or damage that you may have had from COVID that we need to further investigate. And lastly, we can do a pulmonary function test to see how your lungs take in and release air and how efficiently they exchange oxygen. And how do we treat this? Well, for mild cases, if you're only breathless when you're exercising and there's no heart issues or anything like that, what's been shown to be really effective is diaphragmatic breathing. Now, that's a fancy word of saying belly breathing. And so if you were to just place both your hands, one hand on your stomach, one hand on your chest, and breathe in and out, we should see that your belly breathes out when you breathe in and comes in when you breathe out. And that's just a great way of working on the muscles of your diaphragm rather than using your muscles of your chest and your neck to help breathe. And then if you have severe cases of shortness of breath, We're going to prescribe oxygen and pulmonary rehab. Lastly, real quick, cough is a major concern, but cough has been shown to be reduced with over-the-counter medications like NyQuil, Mucinex, or Robitussin. And so those are things that are easily accessible and price efficient. So that's good. So that's everything when it comes to treating specific symptoms with the goal of increasing overall health. However, if you want to tackle everything all at once, there's something called multidisciplinary care centers that may do the trick. Next slide, Dr. Brooks. So, and next one as well. So some clinics have emerged recently in Utah. The University of Utah's long COVID clinic is actually in Salt Lake City. And in Colorado, UC Health has a post-COVID clinic at the University of Colorado Anschutz Medical Campus in Aurora. And these centers, what they do is they bring across specialists across 35 disciplines. So cardiology, neurology, GI, much more, to create personalized treatment plans for you. Now, the upside to that is that they're more likely to have access to new treatments, clinical trials, and research. The downside, however, is that they're usually more expensive and less accessible. There's a few of them around, right? Regardless, still a great approach, and I'm glad we have these centers specialized in researching and treating long COVID. Lastly, let's look at emerging treatments real quick. Next slide, Dr. Brooks. So one promising treatment is metformin. So you've probably already heard of this drug before. It's a common diabetic drug that has shown potential benefits for long COVID patients. Now, originally it was used to lower blood sugar, but it also has anti-inflammatory effects. It decreases inflammation in the body, and also has antiviral effects. It decreases the virus ability to replicate within our bodies. And so, and it's shown, actually recent data has shown that it decreases the risk of getting long COVID by 63%. And so because of that, they theorize then, well, if it can prevent it from happening, then we can treat it from happening as well. Unlike Paxlovid. Paxlovid is a great acute treatment for COVID-19. However, it hasn't shown any efficacy in preventing or treating long COVID. And so that's kind of where that theory comes from. And the great thing about metformin is that it's been used for decades. So we know its safety profile, which is really good. It's widely available, and it's a low cost compared to other potential treatments, right? Next slide. Another one is vagus nerve stimulation. So touch back with what Tilly talked about in the polyvagal theory, right? We can actually stimulate the vagus nerve. Now, this controls almost everything in the body, but one major function it has is to decrease the production of pro-inflammatory cells, so that's the inflammation in our bodies. And so what they actually do is they actually clip a little electrode to your ear that stimulates the nerve, which then hopefully will decrease inflammation in the body, helping to stop the long COVID symptoms that we're seeing. And so that's one that's really cool, really up and coming, and hopefully we'll get good results from this. And next slide, Dr. Brooks. Now, this one is near and dear to my heart. It's using nicotine to treat long COVID. And it is not smoking, though. We're not endorsing anyone to smoke. This is specifically using a nicotine patch. So Dr. Pedrero, who's a preceptor here at RVU, and I are in the process of launching a trial next fall, specifically testing out this theory. And so research has shown that COVID actually binds to a receptor within the vagus nerve that it uses to propel signals, right? Now, if you add nicotine, nicotine actually binds to those receptors 30 times more strongly than COVID does. And so the theory is that when you add nicotine, it'll actually kick off the virus from those receptors and restore the normal functioning of the vagus nerve. And so there's been stellar results in a small scale research within like a cohort of 4 or 5. But we're just trying to see if we can recreate them with more patients to verify if these results hold true. And so be on the lookout for that. We would greatly appreciate your help. And in conclusion, while we don't have all the answers, we're making strides in understanding and managing long COVID. With ongoing research, new treatments, and multidisciplinary care, we are moving closer to providing better support and relief for those affected. And just real quick before I go, next slide, Dr. Brooks. There's research happening all over the place, and new data is coming out every day. And so we want you to find reliable sources and be able to do your own research. And so this is just a quick 3-step process I have about how to find reliable resources. Number one, ask, where is this from, right? If they're from a well-known journal, government agency, or university like Harvard or Yale, they're more reliable than personal blogs, social media posts, or opinion-based websites. And that's because they're usually peer-reviewed. right? Meaning experts in the field have to approve the research before it's published, which just increases its trustworthiness. Second is, can I find this info elsewhere, right? If multiple outlets are saying the same thing, then the truth meter starts writing for me. And lastly, do they list resources, right? If they're showing you where they got their information, then I know that their info is based on reliable sources rather than just opinions or unverified claims. And so in that same vein, next slide, here are my resources that I use to base my presentation. And feel free to reach out to Tilly, Dr. Brooks, and I, and we can get you a copy of that presentation as well as a recording for your own personal use. And lastly, next slide, Dr. Brooks, a couple of action items we have for you. First one is take time to educate yourself on long COVID. There's so much research being done and new data being published. Two is speak with your care team with any questions or concerns that you may have. And if possible, sign up for ongoing research to help researchers understand more about long COVID and how to treat it. Thank you for your time, and I'll pass it over to Dr. Brooks before we open up to any questions.
Thank you both so much. There have been a couple of questions put in the chat, so we'll address those first while you guys are thinking of any other questions, and feel free to unmute and ask those questions. One of our participants is wondering, when would the nicotine patch be used? Is it at the time of acute COVID infection? And Matthias, we're going to hand that one to you.
Yes. So actually, in acute cases, it has not shown to be effective, but after the fact. So once you've been diagnosed with long COVID, after the 3 months resolution of acute COVID is when it's been shown to be effective. So that's kind of our goal with that.
Wonderful. And if you're not looking at the chat, feel free to look at the chat, because we do have participants who are putting interesting information about how they're finding helpful information and what programs they've been looking at. So, and I think it's really important to remember, as Tilly said, everybody is so individual. One of our participants said that nicotine and hyperbaric bariatric oxygen therapy did not help them. So I think that's really interesting. One more question about the nicotine study for Matthias. What's the formulation of nicotine? So, you're not encouraging smoking.
Yes, not smoking. Yes.
No smoking.
Yeah, so the research has shown that it's a nicotine patch at the lowest dose possible, so 7.5 milligrams. And so using that low dose for, I believe it was 2 to 3 weeks, has shown to actually decrease symptoms. And so it's a study that's actually done out in Germany. And with all the patients that they used it on, it went from a scale, they used a sliding scale from 0 to 10. And at the beginning of the study, a lot of them had brain fog, fatigue, difficulty smelling and breathing. And by the end of those 2 weeks, all their symptoms, it wasn't just 1 or 2, it was all the symptoms were resolved. And so it's very promising research, and we hope to just understand it more and go from there.
Excellent. I don't see any more questions in the chat. We do want to give you the disclaimer again that this presentation was for educational purposes only. And if you think you have long COVID or you found something useful in this presentation, please reach out to your healthcare provider or your care team. I think that that's probably your best advice, is make sure you take this information there. We did record the presentation, and the recording, I think, we'll send out to all of the participants, and then we'll get it posted as well. And several people are interested in joining our current long COVID study that Tilly and I are working on. So if you think you have long COVID, we want to pay you to share your story. You can scan the QR code now to join. Oh, and there's one more question. Since there are multiple symptoms, is there any test that can detect it, Tilly or Matthias? Any test at all?
Tilly, do you want to take this?
I'm not aware of one diagnostic that can tell you whether or not you have long COVID.
I know. And that is the hard part, because 200 symptoms, everybody reacts differently to things. And so it's really challenging to diagnose this. There is actually a diagnostic code that doctors can use, but it's so hard to determine when that code should be used, or when it's a different disease. And so, or a different long-term condition. So it is really, really difficult to diagnose. We wish there was a single test.
Yes.
And Shandy, you're absolutely right. We'll definitely check for POTS. We're checking for chronic fatigue syndrome as well. That's something that kind of has the same symptoms. However, long COVID is more waxing and waning. You know, it kind of comes and goes, and whereas chronic fatigue is just stagnant, right? Kind of daily symptoms. And so, absolutely, that's one thing with speaking with your care team, right? It does is that they'll go through everything and try to rule things out before diagnosing you with long COVID.
Yeah, it's that diagnosis of exclusion that can be really frustrating for patients because that takes a while. So,
Leading to more stress and anxiety, worrying about it. It's kind of a circuitous problem. And like I had mentioned, I feel like it may be a problem for us for the ages and the future. It's just a generalized state of unwellness that is almost unpalpable. So anything that we can do to touch it and understand it and treat it, we're all in.
Pat put in the chat, so the home COVID test does not work to detect long COVID. Is that correct? Unfortunately, that is correct. Long COVID, we often don't see evidence of current virus in the system. So it doesn't look like anything on the home COVID test generally. And yeah, you're absolutely right. Sometimes you're like, is this long COVID or is this me just aging? Or is this the fact that maybe I'm, getting rid of influenza or I'm getting a cold or allergies, or it can be so many different things. And I think that is part of the frustrating part for patients, providers, and researchers is it's almost this moving target. How do we find it? Great points. Well, thank you all for attending. We really appreciate the input. We appreciate the conversation, and we are happy to help you direct toward resources or find other resources if you need. So feel free to reach out if you need to join our study if you would like to. We would love to hear your story. Otherwise, thank you so much to our speakers. Tilly, awesome job. Matthias, fantastic. You guys did so good. We hope that this was helpful to you as community members. So with that, have a wonderful rest of your day, and we'll see you for the next doctor's orders.
Thank
Bye,
you.
everyone. Thank you.
Thank you, everybody. Thank you.
Tilly and Matthias, I very much appreciate it. You can see the messages. I left it open for a minute. You can see
Yeah.
the messages in the comments for some feedback. I think this was really useful to people.
Awesome.
Um,
Great job to Matthias too. Thank you, Dr. Brooks, for walking us through these and allowing me to be here today to share this information. This has been really, really great for me in terms of growth and